So what I would like for you to do is to scoot your chairs back just a little bit, because we are going to do some real simple movements. So now, most often, if I mention the word yoga, the image that comes to mind for many of us is that we're going to do headstands or something like that. We're not going to do headstands, but we are going to do some simple movements in the chair. But first, we're going to talk just a little bit. So if you find this piece of paper that says Yoga Therapy for Pulmonary Rehabilitation. So just a few things. The International Association of Yoga Therapists, or IAYT, defines yoga therapy as the process of empowering individuals to progress toward improved health and well-being through the application of the teachings and practice of yoga. So it's really kind of a specialized approach to yoga. So often, if I'm talking with folks and they ask me what I'm doing now that I'm retired, I'll say, well, I do yoga therapy with folks. And the image that comes to mind with them is we're going to find somebody standing on their head or doing, their legs behind their head or whatever. And with the folks that I work with, whether it's in the pulmonary rehabilitation program at UC Health or at any of the 3 Centura hospitals that I work with doing yoga for cancer recovery, we don't do anything that's really extreme. Most of what we do is done in a chair or standing. So we'll come to that in a few moments. We're going to do a little bit of a practice. But first, I would like to share with you the general long-term goals of yoga therapy. The first long-term goal is reducing the symptoms of suffering that can be reduced. The second is managing the symptoms that cannot be reduced. Third is rooting out causes whenever possible. Fourth, improving the function, improving life function. And finally, shifting attitude and perspective in relationship to life's challenges. So one of the things that I've noticed, I'm now 67 years old, and guess what? I'm noticing some significant changes in my body. So I have to really be kind of willing to embrace that, because to the best of my knowledge, we haven't found a way to stop aging, correct? Boy, I would love to be the one to find that. That would be great. So what we're going to do is we're going to do some very simple movements, similar to what I do on Mondays at UC Health Pulmonary Rehab program. And by the way, there are many places around the country where there's yoga that's being done for physical therapy. But to the best of my knowledge, this particular program, Yoga Therapy for Pulmonary Rehabilitation, is the only program like that in the country. So it's unique. All right. So what I would like for you to do is give yourself a little bit of room. I know the food is very tempting to you right now, but just hang in for a few more minutes. And we're just going to do some simple movements. So scoot your chairs back just a little bit, because what I'm going to ask you to do in a few moments is a simple forward bend, and just go down as far as is safe and comfortable for you. But find that you're seated nice and tall, and hopefully you have some room to move your arms. If you're not able to sweep them out, sweep them forward. Okay? So let's do this together. So, arms down, and let's begin by inhaling and bringing your arms straight out from the shoulders first, just straight out. As you exhale, bring the palms together in front of you and allow your chin to come to your chest. Then inhale, sweep out. Exhale, you're doing fine. Inhale. Really expand. Exhale. One more time. Inhale. And exhale. So now we're going to do a little bit different movement. Let's bring the arms in this position. Draw the arms back a little bit as you inhale. Exhale, draw the arms together in front of you. Try to bring the elbows together if you can. Inhale, open out. Exhale. Inhale. Exhale. Good. Inhale. And exhale the arms out and down. Good. Now, what I invite you to do here is to have your left hand resting on the chair. As you inhale, sweep the right arm out and reach overhead. Exhale, bending to the left, opening the right side. Inhale, come up. Exhale, out and down. Switching sides, inhale, sweep. Exhale, bending. Inhale, coming up. Exhale. Inhale, right arm. Exhale, bend. Inhale, come up. And exhale. Last time, opposite side. Inhale. And exhale. Inhale, coming up. And exhale, out and down. Good. Now, scoot your chair back just a little bit if you're close to the table. And let's just try to do a simple forward bend. So whenever we bend the spine or twist the spine, which we're not going to do now, we like to bring the spine back into alignment. So let's sweep the arms forward and overhead. And exhale and fold. Just go to where it feels safe. Inhale, coming up. Exhale. Feel that stretch in the back. Inhale, coming up. Stay upright. Exhale the arms forward and just down to the sides. And let's do that 2 more times. Inhale. And exhale. Inhale, coming up. And exhale, coming all the way down. You could take a bite of your sandwich each time. Inhale. Exhale. That's called multitasking. Good. Now, let's scoot back. So, what I would like to do with you now is a very simple breathing practice. It's what we call in yoga pranayama. It translates as breath control, is the literal translation. I think of it as breath adaptation. So we alter how we're breathing for a particular effect. So find that you're seated nice and tall in your chair. Be supported by the back. And what I'm going to invite you to do, we'll begin with a nice deep full breath in, and I'll ask you to exhale all the way out. Then with the next breath, I'll invite you to inhale halfway and pause. Inhale all the way and pause at the top of the breath as best you can. I see a couple folks going, nope, can't do it. So do the best you can. You might be surprised. And this is one that when I first started doing this at UC Health, I had practiced this at home, and I have pulse oximeter because I'm a respiratory therapist as well. And I would notice that sitting at rest, my SpO2 is about 93. But just with 4 rounds of doing this 2-part inhale breath, I went up to 97, 98 SpO2. So it works. So, back is nice and tall. Just allow the hands to rest on the thighs. Let's begin with a nice, deep, full breath in. Exhale that breath all the way out. Next breath, inhale halfway. Pause. Inhale all the way. Pause at the top of the breath and exhale fully. Let's do that 3 more times. Inhale. Pause. Inhale all the way. Pause. Exhale. 2 more times. Inhale halfway. Pause. Inhale all the way. Pause. Exhale. Once more. Inhale, halfway. Pause. Inhale all the way. Pause. And exhale fully. And relax your breathing. And just notice how you feel after doing that. Anyone notice anything mentally? Just out of curiosity? No? Is anyone feeling anything mentally? I just had to ask. So doing that breathing, and those of you who do have pulse oximeters at home, do this at home and check it out. So what we like to do whenever we finish doing yoga, we like to bring our hands into this position and we say to one another, Namaste. And the translation of that is the higher self that is present and resides in me honors and respects the higher self that resides in you. And whenever I share that, I say it's so much better than the gestures we use as we're driving on I-25. Thank you.